Hey everyone, and welcome to This Explainer. Today, we're diving into some highly technical but absolutely crucial upcoming Medicare billing changes for home health agencies. Now, I know if you're dealing with agency revenue cycles, keeping up with CMS can honestly feel like you're trying to learn a completely new language. So we're going to break this all down step by step so you know exactly what's changing and how your team can get prepared. Right off the bat, let's talk about the timeline. October 1st, 2026. You're definitely going to want to circle this date on your calendar and start setting up those system reminders. This is the exact deadline when CMS is enforcing these new billing rules. Now, 2026 might sound like it's a little ways off, right? But you and I know that in the world of healthcare administration, system updates, and staff training, October 2026 is basically tomorrow. Getting ahead of this specific date is literally the key to making sure your agency's billing doesn't skip a single beat. So here's our quick roadmap for today's explainer. 1. The 2026 CMS billing update. 2. Decoding consolidated billing. 3. Included and exempt services. 4. The 19 new supply codes. And 5. Important billing exceptions. Let's jump in.
Section 1. The 2026 CMS billing update. Preparing for the new codes.
All right, so here's the big headline. Effective October 1st, 2026, CMS is officially adding 19 new HCPCS Level 2 codes, and specifically they're adding these to the Home Health Consolidated Billing Non-Routine Supply Code list. What does that mean for you? Well, it means there are 19 new items that your coding and billing teams have to track, categorize, and process under the consolidated billing rules. It's a very precise operational shift, and missing even just one of these codes could mean some major administrative headaches for your agency down the line. Moving on to Section 2, Decoding Consolidated Billing. What does HHCB actually mean? Okay, as a quick refresher, Home Health Consolidated Billing, which we usually just call HHCB, is the system where Medicare pays for all authorized home health services to a single primary home health agency. Which agency? Well, it's the one that submitted the notice of admission and is actually overseeing the patient's physician-authorized plan of care. Basically, it centralizes the payment. All those authorized services go through one primary door. The absolutely crucial takeaway here is that Medicare makes payment only to that single primary HHA. That means Medicare is not going to pay separately for any of the codes subject to consolidated billing while that patient is in a home health episode or under an administered home health plan of care. 0 separate payments. The primary agency is entirely responsible for it. If your agency is the primary one, you're managing the funds for the whole shebang under that umbrella. Section 3. Included and exempt services. Knowing the boundaries of HHCB. So the scope of included services is actually incredibly broad. We're talking skilled nursing care, home health aid services, physical, occupational, and speech language therapies, medical social services, and just general medical supplies and services. It even covers care for homebound patients that involves equipment that isn't easily transportable. But there is one major glaring exemption that you have to remember. Durable medical equipment, or DME, is completely exempt from home health consolidated billing. Keeping that boundary crystal clear in your mind is going to be vital for accurate coding. Section 4. The 19 new supply codes. Chunking the alphanumeric updates. Now, I know reading a list of 19 alphanumeric codes can make literally anyone's eyes glaze over. So to make this easier, we've organized them into chunks by theme so they're way easier to digest. Our first batch is all about syringe and injection supplies. Codes A4206 through A4209 cover sterile syringes with needles, and they just scale up by volume from 1 cc or less all the way up to 5 cc or greater. Next up is A4210, which is specifically for a needle-free injection device. Following that, we've got A4211, covering supplies for self-administered injections, and wrapping up this category, A4218 accounts for sterile saline or water in a 10 milliliter meter dose dispenser. So that's 7 codes right out of the gate, all tied to injections and fluids. Our second category covers urinary and incontinence supplies. Right here, we have A4318 designating a female external urinary collection cup, which can be with or without a ring attachment, and that's billed per day. Then we've got A4336 and A4337. These are your incontinence supplies specifically for any type of urethral inserts and rectal inserts, respectively. Moving right along, A4341 is for a patient-inserted, indwelling intraurethral drainage device with a valve. And a quick note on that one, this is for replacement only. Similarly, A4342 is for the replacement accessories for that specific patient-inserted drainage device.
All right, group number 3 focuses on ostomy and irrigation supplies, covering codes A4397 through A4399. These represent ostomy irrigation supplies, broken down into sleeves, bags, and cones or catheters, with or without a brush. Oh, and right below that, code A4400 covers a full ostomy irrigation set. Rounding out this particular group is A4453, which is for a rectal catheter, with or without a balloon, used with any type of transanal irrigation system.
And finally, our fourth and last chunk, tape supplies. This is kind of wild, but these are billed very specifically per 18 square inches. I always find it fascinating how incredibly precise these measurements have to get. A4450 is for your non-waterproof tape, and A4452 is for your waterproof tape. And just like that, by chunking them out by syringes, incontinence, ostomy, and tape, those 19 complex codes become so much more manageable for your inventory and billing systems.
Section 5. Important billing exceptions. When does the consolidated rule not apply?
Interestingly enough, there are a few exceptions that completely bypass that single payment structure we talked about earlier. CMS outlines 3 specific scenarios here. First, therapies that physicians perform themselves. Second, supplies that are incidental to physician services. And third, supplies used in institutional settings. So if your agency encounters any of these 3 specific situations, those strict consolidated billing guardrails we just went over simply do not apply in the same way. Of course, memorizing 19 new codes is a lot to take in at once, but remember, they're just joining an already existing list of supplies and services. If you or your coding team ever need to verify an item, you don't have to guess. The ultimate source of truth, the complete master list of all codes subject to home health consolidated billing, is readily available directly on the cms.gov website. Seriously, I highly encourage every billing professional out there to just go ahead and keep that page bookmarked. So we've covered the new regulations, the 19 specific codes, the definitions, and the exceptions. But it really all boils down to this final thought. Medicare is consolidating. These 19 new non-routine supply codes are moving under the Home Health Consolidated Billing umbrella. The real question is, will your software flag a waterproof tape or a needle-free injection device properly so you aren't accidentally seeking separate payments where none exist? The time to update your systems and train your teams isn't in 2026. It's right now. Thank you so much for joining me for this explainer. Keep learning, keep preparing, and I will see you next time.